Hello, everybody. Welcome. Thank you for spending an hour of your day in a discussion that takes us toward a world where everyone counts. I am your moderator, Femi OK. If you think of a pressing public health and development issue that is underappreciated, what do you come up with? Education, maybe? Gender equity? If you say lack of ID data, then I know you're a demographer. High five to you. That is a conversation that we are going to be having in the next 60 minutes or so. We need IDs for everything in life: banking, going to school, traveling, healthcare, but yet there are millions of people around the world who on paper do not exist or have never existed. But now we have tools, we have strategies, we have knowledge for that not to be an issue. Back in April, beginning of April, the New York Times Magazine ran a story which really helped us understand what it means to record births and deaths or not to record those births and deaths, that impact it has on real people's lives. We are going to piggyback on that New York Times Magazine story and really bring this conversation to life. We will have expert guests, your expert questions. I will let you know in just a moment how you can be part of this discussion as well. But we start with Dr. Jennifer Ellis. She is Director of Public Programs at Bloomberg Philanthropies. Dr. Ellis?
Hi, thanks, Femi. Thank you for setting the scene for this important roundtable discussion today. I'm happy to be here. Femi mentioned, this burden of data gaps that the New York Times so pointed to so eloquently. We have currently 45 million deaths and over 50 million births going unrecorded each year, and the majority of these are in low and middle income countries. The reason this matters, as you all know, is without essential data about public health burden, governments have to rely instead on best guess methods with inadequate information to inform their policy and program decisions, their budgets, and their decisions about how to direct resources. To help address this gap, Bloomberg Philanthropies funded the Data for Health initiative beginning in 2015. Our goal in doing so was really to partner with low and middle income countries, including Colombia, who was featured in the New York Times article that Femi mentioned. But we partnered with countries from around the world to sustainably and efficiently improve data on births, deaths, and importantly, causes of death, and to support the use of that data to inform policies. Since then, Bloomberg Philanthropies has committed over $200 million to this issue and have partnered with more than 40 countries worldwide. Our partner countries who really lead this work, have the expertise in this work, and as you saw in the article, are really showing how much is possible to do in this area. Those countries together have more than 5 billion people. And have strengthened more than 12 million death records and 8 million birth records since the work began. And they've trained more than 6,000 people in data analysis. Since we started supporting this work, the world's view of data and the importance of it for informing public health has changed. Of course, the pandemic highlighted how critical data is and how many gaps in our current data structures exist. But even before that, multiple parts of the UN were essential in calling attention to this issue. Countries like Colombia around the world are creating momentum in closing these critical data gaps every day. And it's their work that is making a tremendous difference. Their work also shows, importantly, all of us that working in this field, progress is possible and much, much more is needed. The Times article really has created, we hope, a lot of visibility for this issue, and we hope it'll spark interest and action to build on the momentum of the last decade and help all of us to continue to address the remaining challenges in counting everyone. Bloomberg Philanthropies has been proud to partner with Vital Strategies, as well as our 6 other global and regional partners on the Data for Health initiative to support closing these gaps. Today, in this great roundtable discussion, you'll hear from 5 experts who have long been committed to making this goal a reality. I'd like to thank each of them for their participation in this discussion. And of course, thank you to Vital Strategies for organizing today's virtual event. Femi, I'll hand it back to you.
Thank you so much, Jen. Really appreciate you. All right, so we have experts in our conversation, but we also have you and your expert questions. So let me tell you how you can be part of this conversation as we move through our discussion. Towards the end, that is when I'm going to start bringing in your thoughts, your ideas, your questions, your comments as well. So hashtag count everyone on Twitter, hashtag count everyone, and you can actually email the team as well. They're standing by, they're waiting with their fingers on the inbox to see the questions that you send in to us. press@vitalstrategies.org. So that's email press@vitalstrategies.org, or on Twitter, count everyone. Let's say hello to our speakers. Irina Dinku, so nice to have you. Welcome. Hi, Irina. Irina is from the UNFPA. Irina, what does it say on your business card? Please tell me.
Well, I am a senior advisor with the Center of Excellence for CRVS Systems, which is now hosted by UNFPA and used to be hosted by the International Development Research Center in Ottawa, Canada. So
Good to have you. Stephen McFeely from the World Health Organization. Stephen, hello. Please tell us what your job title is. What do you do?
Hi, everybody. I'm the Director of Data and Analytics at the World Health Organization. So I'm responsible for trying to bring together all of the numbers, including the numbers on, as Jen mentioned, on mortality and cause of death.
Good to have you. Janet Riki Ono. Janet, hello, welcome. For the Swiss Tropical and Public Health Institute, please explain your job.
Yes, I am a medical consultant. I work a lot with civil registration and vital statistics, more in mortality than in birth, but I've been also working former in vital strategies in Peru.
Looking forward to hearing more from you in a moment. Philip Settle from Vital Strategies. Very important title, very long one. Philip, go for it.
Yes, hi, thank you. Hi to everyone. My name is Philip Settle, and I direct the Civil Registration and Vital Statistics program here at Vital Strategies under the Bloomberg Philanthropies Data for Health Initiative.
Thank you for hosting us, Philip. Really appreciate it. And Willem Muhuava. William, hello, welcome from Addis. William, what is your job title? Tell us.
Thank you, Femi. I am actually the Chief for Demographic and Social Statistics at the African Center for Statistics at the United Nations Economic Commission for Africa. And my main work related to what we are talking about is I actually head the Secretariat of the African Accelerated Program on Improvement on Civil Registration. Over to you.
Thank you so much, Pano. I feel so humbled being in your amazing expert arena here, but thank you for allowing me to participate. I would love you to also talk back and forth with each other because it's really great to have this knowledge bank right here. Philip, this idea of civil registration, the idea of making sure officials know when their citizens were born, when they died, what they died from, it seems so simple, but it's a major fail at the moment. Can you explain why?
Well, Femi, I thought I'd start out just by making sure that we know what we're talking about really clearly when we talk about CRVS, or Civil Registration and Vital Statistics. That means the continuous, permanent, compulsory, and universal recording of vital events. And through that, people establish their legal identity. That's the link to ID that you were talking about in your opening remarks. You know, I think in the New York Times article, Steve McFeely pointed out that for many, many years, even decades, civil registration has been a sort of classic tragedy of the commons. That's because at the country level, what civil registration and vital statistics involve necessitates the participation of many different parts of government. And as you also mentioned, Femi, civil registration is not just a health issue by any stretch. It's a real fundamental issue of human rights and development, as well as touching upon health, of course. So the fact that it was and has been sort of everybody's responsibility meant that in many regards it was no one's responsibility. And in the meantime, we've made do with the sort of models that Jen Ellis commented about in her opening remarks, so that countries have been left without knowing how many are born, how many died, without being able to plan and take action using their own data about their own populations. So I think that there has been a combination of forces that have led to a lot of stagnation. But I also want to emphasize that, in 2007, when I said that civil registration was the single biggest development failure of the past many years, that was many years ago. And I think that we can really point with a great deal of pride and enthusiasm and optimism to the developments of recent years, which really have brought CRVS to the fore, including in the Sustainable Development Goals.
Why is civil registration, which seems like that's where you start with your citizens, why is it not a bigger priority?
Well, I think it hasn't been such a big priority because it hasn't had champions. It hasn't had, it's such an invisible difference in a sense, in terms of it being such a small administrative task conceptually, and yet logistically it is so complicated and resource intensive to really create a universal system.
Yeah.
I think that, those who have been development partners have largely made do with things like household surveys. If people might be familiar with the household survey that asks about births and deaths in the household and so forth. That's a stopgap. It gets statistical information, but it does not achieve what civil registration does in terms of establishing one's legal identity. And it does not have the universality and permanence that a civil registration system has. So it's time to leave off these sort of stopgap measures and really roll up our sleeves and do the hard work of actually counting births and deaths.
I love the idea of civil registration champions. Arena, would you put yourself in that league? Do you consider yourself a civil registration vital statistics champion? How did you get to that position?
Wow, I think that this is really a hard question. I started working exactly 20 years ago in Cambodia on the first, mobile civil registration system. So I'd say I have quite a lot of experience. I've been around on 3 continents. And I dare to say that, I champion this issue, and in particular the issue of, gender, females in civil registration and vital statistics and their protection through the life course, as a matter of fact.
Mm-hmm. I love that phrase that you just picked out there, a life course approach. Can you unpack it for us and explain what that actually means?
Well, I'll try to. Actually, allow me to respond a little bit also from the perspective of the individual, because we are often looking at the civil registration systems from the perspective of the government and of the stakeholders. And this is great because we are all supporting the government, right? I mean, even now the international community, what would like to count? And I think that most important aspect here is also protect everyone from where? From birth to death, through marriage, through divorce, and idle vital events. But I'm wondering, actually, what is civil registration for a person born in Matadi or in New York or in Bucharest or in Kiev? I mean, what is this really for them? What does it represent? And if you ask me, I would dare say civil registration is the book of life. Now, it records critical events in the life of the individual and in the community, in the family where he lives and where he dies, events about which the community knows. I mean, it records, for example, that John, 20 years old, from Burkina Faso, is married to Mary, 27 years old teacher, and they had twin girls in Ouaga 2000 hospital in Burkina Faso's capital. Right. So the life course approach to civil registration argues that we must register and document all these critical events at the bare minimum: birth, marriage, divorce, and death with causes, to allow the individual to be protected through the life course in all the sets of legal obligations which he contracts. And it also allows the state to fulfill the obligations contracted through conventions and covenants to which it is party. I mean, for instance, obligations such as, quality education, quality health care, decent work, etc. It also has, the possibility for the state to collect taxes, to give just an example. Now, I think that it also, supports the state to fulfill gender equality, which remains in many parts of the world aspirational, 7 years away from the 2030 agenda, and the life course approach, applied for decades now in health programming, takes a temporal perspectives, but also a society perspectives as well. And I would say it's the cornerstone of good governance and critical to the fulfillment of the 2030 agenda. And I'm not going to come back on what Philip and Jennifer said about the importance of counting everyone in terms of statistics, but I'd like to emphasize that registering vital events, for example, birth, allows the individual to know the name and the place in the society, establishes family ties where possible, links the individual with the state, creates a set of obligations for both of them, and so on. And most importantly, what it does, this legal identity, it allows you to enter in legal relationships that impact not only you, but also your family. For example, if you are in a marriage and your husband goes bankrupt, I mean, you are also responsible. It impacts you financially and mentally, possibly, Marriage and divorce registrations, they allow not only for inheritance, we've been talking and we've been seeing about that, but also about other rights, the rights of the child to remain in contact with the parents, the rights to visit of the estranged parents, etc. And Philip and Jennifer were talking also about, death registration, and you were talking also about it in your opening remarks. But I'd like to say that it's also about closing legal identity. Otherwise, all these people whose births you have registered, they are going to populate forever, your population data sets, because legally their identity is not closed, So you are opening the door to, electoral fraud and things like that. Maybe to end of it, I think that life course approach allows you to actually build evidence-based policies and program to improve well-being and health and economic status.
All right. So at the moment, we are focusing on some of the challenges with civil registration and vital statistics. I'm going to admit to something that I did in the last few years, William, that made me rethink about how important civil registration is, particularly in the era of COVID. And that was, as I was covering COVID lockdowns and the spread of the COVID pandemic 3 years ago, there was a line of thought that I also shared with audiences around the world about how relatively few people on the African continent were dying from COVID-19. Maybe their deaths were not being registered, or maybe their deaths were being registered incorrectly. Certainly one of the countries that is working with civil registration and vital statistics, trying to improve it. There's one country in particular that I know on the eastern side of Africa where they weren't even allowed to register COVID-19 deaths. So I took the limited amount of statistics and then broke that down and then broadcast it to the world. But that, William, could be completely incorrect. Isn't that one of our biggest challenges, how inaccurate the data might be?
Thank you so much, Femi. You bring in a very important aspect, especially how our civil registration systems were tested during the COVID era. And one of the things we observed in Africa was the unpreparedness of our civil registration to actually provide real-time information about the deaths which were occurring due to COVID. So we actually observed that our systems were not even responding to what they are supposed to do, which is to record a death immediately after it occurs or within a certain duration. So it was one of the observations that one of our biggest failures in Africa was actually the inability of the civil registration systems to actually record deaths, not just only for for COVID, but for all the other epidemics which have happened, especially Ebola. It has, had such a big impact in the West African region, but we up to now don't know how many deaths were impacted by Ebola in West Africa. So that has taught us a very, very important lesson that our civil registration systems are very reactive. They wait for a client to come to the office and register a death. But if we look at what was happening in the COVID era, some of the deaths were happening at home. Some were actually happening in private institutions and so forth. So because our systems are so reactive and waiting for, informants to come and register, then we missed a lot of deaths which occurred during those, pandemics. So from that observation, what we have now recommended is we need systems which are actually proactive. And these systems should be based on community reporting. Because in the communities, somebody has the information. We know in Africa, for sure, every death requires a burial order. From South Africa to Egypt, it's standard. So this information is somewhere. But what we are failing to do is to move it where it is. If we look at births, even births which are happening at home, there's a traditional birth attendant who has attended to that birth. So the information in a village might be with a birth attendant, but you hear that those children do not even have birth certificate. But if you want and ask this birth attendant, she can give you, in the last month, I delivered 5 children. So the information is resident somewhere. What our systems are failing to do is to move this information from where it is, these burial orders, these information with the traditional attendants, the communities, leaders, and so forth. I know in countries where community leaders are actually asked, if a death occurs, you cannot bury without informing the chief. So the information is resident somewhere. What our greatest failures are is to move this information. And I think at a subsequent, intervention, I will actually talk through what we recommend, especially to move this information from where we know it is and where we have now realized it is to where it will be in the civil registration database.
All right, thank you. I'm thinking, Janet, I want you to take us from challenges into successes. But before we get there, Irina, I could tell you wrote something down. What did you write down? Share it with us.
No, I was just thinking about what William, so wisely said about communities. And I think that we as as a community of practice, too often we are not listening to the voice of the communities. I mean, these are events which have been celebrated long, I think, in our communities. Everybody knows when a child is born, there are celebrations around marriages. People know who divorced what, why, etc., who died of what, but we are failing to bring this into the civil registration systems. I don't know whether it is because of oral societies or our lack to, our insufficient knowledge on how to build trust into the civil registration systems. That's what I was wondering.
Philip, go ahead. Articulate your nod, Philip.
Yeah, no, I really appreciate the discussion so far. I think that Irina really reminded us of the fact that civil registration is a rising tide that raises all ships, each individual and society at the same time. It's very unique in that regard, in that it has its fundamental reason is not a statistical one, actually. Its fundamental reason is to provide individuals with a name and a nation, or as it said in the Declaration of Children's Human Rights. And the statistical use of that information is a very beneficial byproduct of making sure you have this basic demographic information and so forth about every birth, marriage, divorce, and death that occurs. So that's a very important point to emphasize. And I was nodding because I really agree that, you know, when we talk about people being invisible, of course, that's a dramatic statement. As Irina said, events, life events, vital events are celebrated. Everybody participates in these wonderful occurrences or these sad events of a death at the local level. And as William so nicely put it, the trick is that it's just not visible to the state apparatuses or the governmental apparatuses that can bring the benefits, secure the rights, deliver the services, etc. So I think that these are some really essential points to bring home. And lastly, you said you wanted to talk about some successes. Do you mind if I bridge to that?
Yeah, please do.
So, as William pointed out, many civil registration systems are very passive. There's someone sitting behind a desk at an office who waits for the poor farmer to actually take 7 buses and a mule to register an event and then come back again to pick up the certificate. And it's costly in terms of time and effort. Rather, we have begun pioneering more active ways of getting people who are already in the community but who have a link to the health system, for example, to be the face of that system in the village, at the local level, to build on the social relationships that they have. So it's technical know whom, not just technical know how. And it becomes an opportunity for an active way of obtaining the information and moving it, as William said, to the places where it can be used for statistics, for planning and evaluating services, for empowering women and girls, and for raising up the standard of opportunity for the entire population in an equitable manner.
Gianni, I am tasking you with telling us stories, success stories, not just about data and demographics, but people and lives and countries. Where do you want to start?
Well, there are so many stories in Latin America and in the Caribbean, and they have many improvements in CRVS so far. For example, technology is helping a lot in Latin America. In Peru, where I live, we began the birth registration online since 2013, and if we talk about statistics, from 75% that we had the information from, we improved to 98%. So this technology, what it does is, like Philip said, is we now can have in this village or these rural areas or remote areas where there are not many places or hospitals, but with this technology we have moved them and made some mobile registration, and with that we can help them to register them, because in the past, if they didn't go to the civil register office, for example, they couldn't get the identity, and for some of them it took like 2 hours long travel to go to somewhere where they can get registered. There are many countries in Latin America that is working in taking this registration to the people, instead of people getting to the office. And it's starting now, and I think it's getting a lot better now.
Janet, you say that so it's like it's so easy, taking the registration to the people. It is not easy. We are talking about going through really difficult territory on the back of motorbikes. Janet, don't let me exaggerate, but let's be really candid about taking registration to people. What does that involve?
Well, it's not easy at all. It takes a lot of implementation, a lot of people, a lot of work. But I sincerely believe that it's more than the government. I think they have to compromise to give the people or the workers, the implementation and the tools so that they can go there and do this. So it's has been difficult. It didn't start just yesterday. It has started a long time ago, and we are still getting there. But I think with technology is getting much faster than before.
Yeah.
So I think
You're
that
smiling, Janet, you're smiling. So this means that it's going well, right?
Yeah.
You're beaming.
Going well.
Technology, are we talking, Philip, just phones? Are we just talking phones?
Sometimes smartphones or small tablet computers. In Bangladesh, for example, we have supported the government to develop and scale nationally an active model of registration in which people who are already based in the community have either a smartphone or a tablet computer connected to the civil registrar. And when a birth or a death happens, they go to the household with either a letter congratulating on the birth or a condolence letter. They assist the family to complete the registration there and then at the household. The family doesn't have to travel. And that technology then is able to, through the telephone lines, through the internet, transmit that registration information to the central location. Bangladesh went so far as to actually enshrining performance targets for civil registration for civil servants in their pay for performance scheme. So there's a lot of incentive coming from the government side to be more active, and there's a lot of reduction of barriers to registration through such a system. And we have seen registration of births go up about 5-fold and deaths about 4-fold under this national system.
William, I'm thinking about many of the countries in the African continent, which will be going right now from a paper system that may not be accurate, may not be complete, may be out of date, to a digital system. So if this is almost leapfrog technology here, where you're jumping from paper into a new tech and new knowledge, how is that being handled and managed? Where would you take us to give us an example of how it's going well?
Thank you so much, Femi. This is a very critical thing because when we are looking at Africa, we are actually looking at a region or a continent of disparities. We actually have, countries which are at the formative stages of civil registration. Then some are at universality, like, Egypt, South Africa, and so forth. So when we talk about this issue of digitalization of technology, we actually need to think what fits which group of countries. So like the low performing, there are some whom we call low performing. We actually don't even recommend them to touch technology because it can be damaging to them, because it's a facilitator, not the answer. So the answer is to have a very good, well-functioning manual system, and it's very easy to now translate it into a digital. Because what happens in most of these countries, they want to jump into technology. Then they find possibly the solutions which they've chosen are not the right ones. Some even go into partnerships with private companies and end up in this vendor locking system. So what we have done is to actually come up with strategies. We actually have a working group now consisting of our partners like Vital Strategies, CDC, WHO, and so forth, who are working in this field and saying, let's review the technological approach which we should use, which will be beneficial to these countries and won't even lead them into, problems of technology, being
So,
negative.
William, are you being deliberately general and vague here, or do you want to land us in with a specific example? Are you trying not to mention a particular country or region?
Yeah, I wouldn't really mention a country, but
Arena's laughing. This is what we learn at the United Nations: is you do not pick countries. But I did want examples.
Yeah, but
You're
that's
doing
true.
a good job of vaguely giving us examples.
Yeah, there are 2 or 3 countries which have come to me,
yes,
and which we have struggled with on vendor locking, and we tried to negotiate with the service provider, and so they lost all their data. They started afresh. So they only have data for the last 5 years. But let me emphasize on the point which Philip, mentioned. We have also started those initiatives of using cell phones, because everybody has a cell phone. At least there should be people with cell phones in the communities. And in some instances, what we have done, because every country is doing a census, we have actually asked whatever tablets remain from the census should actually be, at least a part of them, given to civil registration, so that they can be, used for registration and so forth. So we are using all these different approaches and trying to come up. And I can say with confidence that where we have used tablets, or where we have used community leaders like the traditional crowheads and so forth, and given this, because the most important thing, I think, which I need to, is notification.
yeah.
Because once you have notified an event, at least the record is there. And this is where we are failing, because we have a lot of all these events which are unnotified. So where we should focus on is to make sure that the events are notified, and then it goes to the second stage, which I actually referred to. If we have proactive systems, they should be able to follow up, leave their offices, leave their desks, and say, let's go to these villages once in a month and actually complete that information, because the notification is there. We know in village X there are 5 births and 10 deaths. We can go and over a day complete that information. That's where we are failing, and that's where we need intervention.
All right. So, panel. I ought to mention the obvious here, because unfortunately from the WHO, we have lost Stephen Mafili, which is a great loss. So Stephen, we're so sorry that we lost you. If you're able to pop back in, send us a question. We'd love to feature you in this discussion in some way, but at least we had you at the beginning, and we appreciate that little bit of time that we had you. Let's go to some questions, and let me remind you, audience, thanks for staying with us, where you can put those questions and be part of this discussion. So it's #CountEveryone. So that's on Twitter. So you can tweet your question, or you can actually email us right now, please, at press@vitalstrategies.org. That's press@vitalstrategies.org. I love your questions. Let's get to them. So many people view counting births and deaths as a logistical task for ministries of health, but you've emphasized the need to see it as an issue that needs to be worked on by all areas of the government. So who should be held accountable? I feel like that's Stephen McFeely asking that question. That's Stephen's territory. Arena, you start.
Well, I'm not a health specialist, and definitely very much, I don't think that this is really solely a task of the Ministry of Health. Ministry of Health, in my view, has a notification role, right? But what does the law says? What do we register? We register vital events defined by the law in the conditions stipulated by the law, because this has legal consequences, my friends. If somebody goes to the civil registration office and says, X is the father of my child, and he puts him down on the birth certificate, this has legal consequences for the child and for the so-called father. Marriage is an act in which people are, giving their consent freely. So I think that this really has implication, and it's well beyond the Ministry of Health, which role it's respectable and very good, and it has a role of notification. But I think we should leave it, give to Caesar what belongs to Caesar, leave it with the public administration. In the conditions defined by the national legislation, mostly, I would say. And I think it's not only about births and deaths, but please bring into the conversation as well marriages and divorces, for the important roles they play, in particular for women and girls and vulnerable population.
Sure. That question of responsibility, Janet, whose is it? I've got so many expert panelists here. Nobody is representing a government on this panel, and yet you all really care about marking births, deaths, marriages, divorces, but no government voice in here. Is that important? Is it a government job, Minister of Health job?
No, it is a government job, because as Irina said, the Ministry of Health is just a little part of the whole system that has to register it. So because Ministry of Health only notifies the death that goes in their health facilities, but what about the ones that goes to the forensic doctor, or the one that dies in an accident, or the police get to them, or there are a lot of other ways that people can die that is outside the Ministry of Health. So it's actually a lot of government. It's the government that has a lot of different actors that has to play a role in it. This is the police, is the Ministry of Health, is the Civil Registration Office, is the National Statistic Office, it's also the legal system. So there's a lot of people and actors that have to be involved, and it all is resumed in the government, actually, right?
I love this next question, Philip. I'm going to start with you on this one. We've talked about registering deaths, but what about causes of death? How can countries collect data about what people are dying of, and where and when? Such a
terrific question. That's a terrific question, and it's a shame we lost Steve.
Yeah.
There are two main ways to assign a cause of death. One is for a death that is attended by a physician at a health facility. The physician can write what we call a medical certificate of cause of death, so as not to confuse it with a death registration. So it's a certificate of cause of death. There is a very, very elaborate and structured way to correctly fill that form that applies universally. And those standards are indeed set by WHO. And yet, as William pointed out in relation to the COVID pandemic, so many deaths occur outside of health facilities, and they are not attended. And there is no doctor to write a medical certificate of cause of death. In countries where we work, up to 80% of deaths occur outside of health facilities. Then you need the police, as Janet pointed out, for what we call medico-legal cases, car crashes, accidents, suspicious deaths. So you need to involve that ministry. And you need to involve the Ministry of Local Government and Affairs to establish relationships with communities so that information can be collected on causes of death from those communities. And just to wrap up, Femi, I'll mention the tool that we use to assign causes of death where there is no doctor is called a verbal autopsy. A verbal autopsy is a structured interview with the people who were caring for the deceased person in the period before death. And it asks them to list out signs and symptoms that can be reliably reported on by a layperson. Was there a fever? Were there convulsions? Did they lose consciousness, etc.? That pattern of responses is then used by either a physician or a computer algorithm to assign a cause of death. So to answer the question, causes of death need to be assigned using either a verbal autopsy or a medical certificate of cause of death according to WHO standards. And we need that verbal autopsy because so many deaths occur at home.
I remember when I first heard about what a virtual autopsy was, and I thought the level of humanity and kindness and empathy you need to sit with a family who do not have the paperwork for their loved one passing, but you got to get them to talk about what happened and why they died, Philip. It's extraordinary. Where did that come from? Who came up with that idea?
Verbal autopsy was primarily a research tool for many years. And in that context, of course, there were provisions made for the fact that you're discussing extremely traumatic events with bereaved family members. So there are a couple things that we try to do to mitigate that and to build relationships. One, it's a great advantage having the person who goes to the household be a known individual in the community, not someone riding up on a motorbike from the district capital. Second, we wait until the mourning period has elapsed. Often there's a culturally prescribed mourning period, and we try to avoid doing interviews during that period. Third, we do provide training, of course, to the interviewers, and we talk about the sensitivities that are clearly involved. And we do know, having done many of these verbal autopsy interviews myself, we know it takes a toll on the interviewers themselves, and they need support because for the death part of the civil registration piece and unpacking the cause of death through an interview with survivors, it is indeed a very emotionally charged and laden kind of interaction.
Absolutely.
That said, we do have good response rates. There aren't many who refuse, but some do, and of course they're free to.
Sure. William, you're such a diplomat. I'm going to ask you this question. I'm fascinated as to how you're going to answer it. All right. What does it take to persuade officials to make civil registration, vital statistics a priority, and then make sure that it's sustainable? Be candid.
Thank you so much. This is a very critical question, and I think you have rightly asked it on this forum, because that's what our work entails, is to actually persuade governments that civil registration is a public good. It cannot be offered by private sector or NGOs or even private individuals. It is actually the role of the state to actually provide this service. So what we are actually now doing is to actually make the governments realize that it is their responsibilities. And all of us who are here, we are just helping them to build the systems. But there will be a day when the UN would say, we have done enough, and we are actually handing over all these initiatives to the government and so forth. Vital strategies, they are exiting and so forth, because we cannot be in countries forever and trying to build their systems. So in all this, what we are doing, one of the most important initiatives which we have actually come up with is called the investment case. So we actually assist governments that even when they are budgeting, the ministry which is responsible for civil registration, and normally it's Home Affairs or Interior, we are actually trying, we are, capacity building them so that they can ask for more, because they are the primary. And as Irina says, it's about identity. It's about recognizing who are your people. It's only can be done that way because they've been given an identity, and that identity is authenticated by that credential. So once governments start realizing that it's their role, then they even change their budgeting, they even change the way systems are being done. And I think we are succeeding in those endeavors of trying to, there are 4 or 5 countries where we have actually worked on this investment case and say, let's see if we can move your budgeting from 40% government, then 60% international organizations, to somewhere like 75% government, then the other 25% will actually be international donors and so forth. And the country managed to do it. The way we have managed to actually convince countries to fund their own censuses, we are using that very same approach and saying, this is even a better data source for your planning and for human rights and just for the individual recognition, because somebody has to realize I'm Femi, I'm William, and so forth. So because we have that critical role which gives the person identity, which is actually very critical to what Irina says, that identity, which makes us walk into a bank and say, I am confidently William, but I'm not Philip. All those things, we are now capitalizing on those and using them to convince government that you have these responsibilities to make people recognizable, to make people have, their own rights, to have them their own identities and so forth. And the fourth one now is the investment cases.
All right, so Carol, I'm thinking about 2030, which is just 7 years away. It's when the Sustainable Development Goals are supposed to be achieved. And I'm thinking, if we have this conversation in 7 years' time, where will we be? What would we have achieved? Janet, look into the future. What do you expect?
I think we are in the right path, actually. If we can compromise more the governments and these institutions in so many countries, I think in 7 years we can think that we are almost there, achieving the numbers that we need, so everybody is counted.
Everyone is counted. Is that the number you're going for?
It's the number everyone. It's the number we want to. Wow. Always.
Irina, 7 years' time.
Well, I really don't have a globe, but I think, we could be on track. I think we could be on track if we scale up. If we learn, if we fail fast and we celebrate our failures, as a matter of fact, not only the successes. And I think that, picking up on William and a little bit of all the colleagues around here, building not only an investment case, but really an economic case. Look, go to the finance minister of the Democratic Republic of the Congo and say, you are having presidential elections next year. Last election costed you and the international community, an overwhelming $600 million. If you have a civil registration system, this is how much your electoral lists are going to cost. And this, the other money could be used for economic progress or whatsoever. And we failed, I think, a little bit into this economic case. Work with the communities, really. I mean, bring really the mothers and the marginalized groups and the grandmothers into the conversation. Listen to their opinion and feedback to them, not only take from them, but feedback to the community. Help them understand we are past the awareness. We have to go into the social change. What are the triggers we have to push to actually reach 100%, birth registration, 80% death registration, and a decent, at least marriage and divorce registration coverage, which doesn't come from the census, but from the CRVS systems.
William, in 2030, will every African living on the African continent have a birth certificate or a death certificate?
Thank you so much, Femi. That's what we are working towards. And one of the things which we are going to do in almost like 2 months, we are going to bring all these 54 ministers to Addis Ababa and say, we are left with 7 years. What's the strategy? We want the answers to come from them, not from us. We want to say, Chad, what would you want to do? Kenya, what would you want to do? Zimbabwe, what would you want to do? Because I think we have some of the answers, but the answers are not fit for purpose. So we have the pillars which we have identified. One is decentralization. These services have to be decentralized. I mean, you have huge countries like the Congo, Nigeria, for example. I've been, to Nigeria a number of times and say, we need every Nigerian baby to be, then they tell you of the vastness of the country. So decentralization becomes quite critical. And we want each country to say, we accept that we are not as decentralized as we want possibly a registration center within, let's say, 10 or 20 kilometers. How do we attain that? Then the second one is integration. One thing we haven't talked about here is actually how the health sector can help. We know that for sure about 2/3 of these events we are talking about occur in a health facility. So how come a mother walks out of a hospital without a notification, and once they go home, their priorities change?
Just so that I can leave Philip time to give his predictions for the next 7 years, can you answer that question? Will that mother in 7 years' time walk out of a hospital with her birth certificate? Is that possible?
Definitely, that's what. Definitely. So we are strengthening systems so that no mother will walk out of the hospital or a maternity ward without
baby in one arm or babies in one arm and the birth certificate in the other one. All right, excellent. Philip, goodness me, you are working so hard at Vital Strategies with the tech, with the knowledge, sharing that knowledge. Where would you have got to by 2030? What's possible?
By 2030, a lot more is possible than I would have said 10 years ago. 10 years ago, we didn't know what worked. Now we have a much better sense of what does work. And there's still outstanding questions. But as Irina said, if we scale, if we get the coordination and collaboration among the stakeholders at the country level, we raise awareness in the community about the importance and relevance, then I think at the root of it all is that civil registration is by far the best bet for ensuring no one is left behind. Everyone obtains the rights, protections, and access to services to which legal identity entitles them, and governments can plan and develop using their own statistics and data.
This conversation featuring Philip, Irina, Janet, and William will be available a little bit later online in a recording. We will get that to you, so don't worry if you've missed a little bit of it, you'll be able to watch all of it. If you'd like to find out more about the work of Vital Strategies in terms of civil registration and also Vital Statistics, 2 places that you can go. You can follow at Vital Strat on Twitter. And you may recall that we've been mentioning a New York Times Magazine article. It came out on April the 2nd. It's a long read, I'm warning you now. It's also a long, fabulous listen. And I'm going to give you the full title, The Incredible Challenge of Counting Every Global Birth and Death by Janine Interlandi. It is really special. It kind of ties up what we've been talking about, and you will walk away either listening, having listened, or having read, knowing why this topic is so important. Thank you, speakers. Thank you, audience, for being part of this conversation that takes us toward a world where everyone counts. Take care.